Heroin was edged out by the more powerful synthetic opioid fentanyl. But fentanyl's effects don't last as long as heroin, and so xylazine was added to street fentanyl to give it legs, according to Sarah Laurel, who founded Savage Sisters, the harm reduction group that employs Sherman. Xylazine is not approved for humans, but it's widely available for veterinarians to sedate large animals like horses. Like an opioid, it can kill pain, but it cannot be reversed with Narcan. Also known as naloxone, which is used to treat opioid overdoses, according to the U.S. Drug Enforcement Agency. As xylazine is usually mixed in with fentanyl, naloxone can help an overdosed person by counteracting the opioid, though other measures may be needed. Workers at Savage Sisters now carry oxygen tanks with them. The drug has side effects like trank walk, where people seem unaware of their surroundings, along with sores and wounds. Trank made its mark on Philadelphia's street drugs about 3 years ago. That's when doctors, users, and those who try to help them saw a difference. Synthetic opioids, like fentanyl, are fueling the rise in overdose deaths. Over the last several years, deaths by synthetic opioids have been on a sharp incline, while overdose deaths by heroin have dropped off. Drug overdose deaths per 100,000 U.S. residents, 2001 to 2021. Nobody was coming to Kensington to buy trank, they were coming to get heroin, said Laurel of the Savage Sisters group. You don't go to your drug dealer and say, "Do you have a nutrition label with this?" You get what you get, and you don't get upset. And whatever you get, you eventually feel a physical compulsion to do, she said. Kensington, now the fentanyl supply has adulterants to xylazine, is in 9 out of 10 samples of lab-tested dope in Philadelphia. Infections from intravenous drug use. What is intravenous drug use? Intravenous injections rapidly admit drugs into the body by way of inserting a needle into a peripheral vein in the arm or leg. Otherwise known as shooting, slamming, banging, blasting, or mainlining, intravenous injections usually result in a much more rapid availability of the drug into the system. Intravenous injection also leads to a greater risk of dependency and infection from dirty needles or usage of toxic drugs. Why does for drug use produce infection? When it comes to for drug use and infection, there are many factors to consider. Bacterial infections are caused when germs on the skin, or within a contaminated needle, are pushed through the skin and deep into the body. Injecting a substance into the skin bypasses the usual barriers of entry that our body uses to protect us. If infection-causing bacteria reach blood vessels, it can result in infection of the widespread deep tissue, veins, or vascular tissue. Those who inject subcutaneously or engage in skin popping are at higher risk of developing infected blisters, subcutaneous abscesses, or pustules when users share needles or other injecting paraphernalia. Blood-borne infections like HIV and hepatitis C are common. Those who live in poor conditions and engage in intravenous drug use usually have a lack of hygiene and poor nutritional habits that contribute to the risk of getting other infections from shooting up, such as staph is the deadliest skin infection. With over 30 varieties, staph infection symptoms can range from mild to life-endangering. Commonly injected drugs. The most commonly injected drugs are heroin, amphetamines, barbiturates, buprenorphine, benzodiazepine, cocaine, and methamphetamine. Cause of bacterial infections, skin and soft tissue infections. Bacterial infections often arise from injecting a needle into fatty tissue beneath the surface layer of skin. Veins that leak during injection along with toxic drug usage can cause infection as well as tissue morbidity. The presence of bacteria on the skin surface while injecting can also result in bacterial infection. Types of bacterial infections: abscess, botulism, cellulitis, heart valve infection, HIV infection, AIDS, liver disease, tetanus. The spread of the HIV virus across China, Central Asia, and Eastern Europe closely corresponds with the rapid rise in intravenous or for drug use. Signs of infection. If an infection is present in bodily areas that are frequently injected, the injection site will become tender, warm to the touch, and red. A frequent pattern of injection causes infections that lead to discoloration,